Morning, everybody. My name's Howard Weissman. I'm Executive Director here at NCADA. You think we have enough NCADA logos? NCADA, as many of you know, we work to reduce or actually prevent the harms associated with alcohol or other drug use, and we do that through education, intervention, and advocacy. Now, advocacy on behalf of any misunderstood or stigmatized group can be difficult. So advocacy on behalf of those wrestling with substance use disorders can feel like spitting in the wind, especially in Missouri, and especially in the current political climate down in Jeff City, where sometimes it feels like nothing gets done. Well, today, we're all here to announce that in St. Louis anyway, something did get done, something big got done. A few short months ago, St. Louis County Executive Steve Stenger did something very innovative and unique in that St. Louis County passed the first municipal prescription drug monitoring program anywhere in the country. Now that's the good news. The bad news is that the reason it's the only municipal PDMP anywhere in the country is because Missouri remains the only state without a statewide PDMP. This despite the heroic efforts of Representative Holly Rehder to advance a bill. There is one lone obstructionist in the Missouri Senate that held it up again. But the lack of a statewide PDMP doesn't mean we have to accept the status quo. Doesn't mean we have to accept the loss of more than 9 souls every week in the St. Louis area. Doesn't mean we have to wait until next year before acting. And that's why we're here today. Mayor Francis Slay, along with Alderwoman Cruce and others, have championed legislation to create a prescription drug monitoring program for the city of St. Louis. This is an enormous victory for anyone concerned about public health. And it's welcome news for doctors and pharmacists. It'll improve their ability to care for their patients. And finally, it's a victory for the residents of the city and the county, because it's going to make this a safer and a healthier place to live. But our work and the work of other advocacy agencies like the Missouri Network for Opiate Reform and Recovery, work's not done. Missouri still needs a statewide PDMP. We still need a 911 Good Samaritan law. Addiction is a cunning disease. And there may be a brief uptick in heroin use when prescription opioids become harder to obtain or misuse. But that will pass quickly. However, a larger problem remains. Treatment professionals will tell you that we can't treat our way out of this problem. Law enforcement professionals will tell you that we can't arrest our way out of this problem. The way forward, it seems to me, is prevention. So we urge a major investment in universal school-based prevention for all kids, starting in kindergarten, because prevention is about helping kids connect with their families, their schools, their communities, and their own emotional lives. Helps them withstand the pain that sometimes life brings, and it helps insulate them from the known risk factors that sometimes lead to addiction years down the road. So we need to address this for what it is, our most expensive public health problem, and that requires a large but affordable public education campaign. In the meantime, this prescription drug monitoring program, a giant first step. So please help me in welcoming County Executive Steve Stenger to the podium.
Thanks a lot. Thank you. Thank you all. Thank you very much. It's a real pleasure to be here this morning. I'm joined by my health director, Dr. Faisal Khan. There's a reason why we're here, and Howard hit it head on. We all recognize, everyone up here and everyone in this room recognizes that we have a real issue with prescription abuse. 4 out of 5 individuals who start with prescription abuse move on to heroin. We know that's a real statistic, and the statistics go on. So we recognize that we have an issue, and I'm really proud this morning to stand with Mayor Slay and Alderwoman Cruce to take one more big step in combating this problem. And we can't do it alone. St. Louis County can't do it alone. St. Louis City can't do it alone. So we're doing it together, which is absolutely fantastic. So I want to congratulate Mayor Slay. I want to congratulate Alderwoman Cruce. Congratulations, and to all the city of St. Louis on enacting their prescription drug monitoring program. In March, when St. Louis County Council, at my recommendation, passed legislation establishing the county's own drug monitoring program, we certainly invited others to join us. And I'm proud to stand this morning in the fight to stem the epidemic of prescription opioid misuse and heroin addiction. The Centers for Disease Control report that prescription opioids are the gateway drug, as I said, for 4 in 5 heroin users. High school-age youths have proven particularly susceptible to this epidemic. Drug monitoring programs that require doctors and pharmacists to enter all prescriptions into a database have drastically cut pill shopping wherever such legislation has been enacted. And certainly it would be absolutely wonderful if we could have this statewide, but if we can't have it statewide, I think we need to create our own, and I think we need to send, we really need to send a message that, this is something that needs to be addressed immediately. Quite simply, the drug monitoring programs that the city of St. Louis and St. Louis County have established will save lives. And again, I thank you and congratulations on taking this important step to protect the public's health and safety. Thank you. And I now introduce to you the mayor of the city of St. Louis, Francis Slay.
Thank you, County Executive Stenger. Thank you for your leadership and this county's leadership on this very important issue. Howard, thank you, and everybody at NCADA and everyone that's here today for your interest in and all the work you do on this very, very important issue. I'm here with my health director, Melba Moore, this morning, and I just want to thank her for all her work. And, when County Executive Stenger and I were here several months ago, we promised that we would do something regardless of what happened in the state legislature. We were also here, of course, at the time with Representative Holly Rehder, who is going to speak in just a moment. Despite her real strong efforts at state level, it did not get done there, so we did not want to wait to see what happened at the state of Missouri. The county took the first step. We are shortly behind with the leadership of Cruce, who you'll hear from in just a moment. She was the primary sponsor of the bill. Make no mistake about it, it would be a lot stronger and better if we had a statewide effort, but in the absence of that, we're working together between St. Louis City and County. We will demonstrate, as the county executive said, that we will save lives and that we are going to make a difference and that it is going to be worthwhile. It's not going to, this isn't just something on paper. We're going to actually save lives as a result. Prescription drug abuse is one of the fastest growing drug problems in the United States of America and has been classified as an epidemic by the Centers for Disease Control and Prevention. The CDC calls monitoring programs like the one we are establishing as an effective tool to combat the nation's opioid abuse epidemic by monitoring painkiller prescriptions and tracking patients who overuse those drugs. According to the CDC, that abuse often escalates into heroin use, as we heard from the county executive, which is cheaper and easier to get. The NCADA, which graciously agreed to host us today, is seeing that firsthand. And our friend Chad Sabora can tell you more about that in just a moment. But they can attest doing heroin is as easy as swallowing a pill. and its users are increasingly anything but stereotypical. People with as little as $10 in their pocket can buy a button of heroin. It's cheap, it's strong, and it's deadly. It touches families from all walks of life, County Executive Stinger's family, and my family among them. People who died from heroin in the city of St. Louis last year ranged from the ages 19 to 68. Drug overdose is the #1 cause of injury-related death in the United States, and 3 out of 4 new heroin users started by misusing prescription drugs. We agree with the CDC that monitoring prescriptions of painkillers and tracking patients who overuse or abuse such drugs will lead to saving lives. We are united in helping to combat this heroin epidemic, to educate, and to save lives. Thank you to NCADA for the advocacy and counseling you provide, and thank you to this entire team for bringing this issue into homes and legislative chambers alike. It is now my pleasure to introduce the leader from the Board of Aldermen who headed this effort up. It's the primary sponsor of the legislation and a fierce advocate for our prescription drug monitoring program legislation, St. Louis Alderman Cruce.
Good morning. Thank you to Mayor Slay for inviting me to participate in the signing for Board Bill 36. Also, thank you to County Executive Steve Stenger for leading the way on this issue a few months ago and passing PDMP in St. Louis County. We modeled our bill in the city after the bill that was passed in the county. I also appreciate the time that County Executive Stenger took speaking with me about how we could take a regional approach to this issue. 2 other people that I'd like to mention that have been important in this fight are County Councilman Sam Page, who is a physician. Many of you may know him, and he has really led the way on this issue, both at the state and at the local level. And also Alderwoman Kara Spencer, who was instrumental in supporting this bill in St. Louis City, and she is also the sponsor of the Good Samaritan bill, which we hope to pass in the city in just the next week or 2. Thank you. The PDMP bill passed at the Board of Aldermen almost unanimously, which is not that common. I think that we all know that the abuse of prescription drugs, particularly opiates, has led to an epidemic of opiate and heroin deaths. Many medical experts believe, as you've heard from the mayor and the county executive, that the heroin epidemic is a direct result of the lack of oversight for prescription drugs. That's why 49 other states, every state except Missouri, already has passed the prescription drug monitoring program. The way this program will work, like St. Louis counties, it requires the dispensers of Schedule 2, 3, and 4 controlled substances to submit the details of that prescription to the registry within 7 days. The information is then available to doctors and pharmacists who are providing care to the patient. The registry won't prevent patients who need the medicine from getting it, but it will allow the dispensers to make informed decisions about if, what, and how much they will prescribe. The City Health Department will work together with the County Health Department and use the same program. The program will be easily scalable to assimilate other cities and counties when they come on board. This is the best that the city and the county can do together. It's good regional public policy. The epidemic that we have does not know the city-county border. Thank you. I'd also like to introduce this morning representative from the 148th District in the state of Missouri, Representative Holly Rehder. Holly.
Good morning. It is such a pleasure to be here. I cannot tell you guys what an honor it is to be among these individuals who have worked so hard to say we're not going to wait for the state to do something about this public health crisis, which is what we have in Missouri, due to the fact that we don't have a PDMP. I was horribly disappointed, of course, in the legislature this year as we worked very hard to get it out of the House. Had a lot more trouble in the House this year than we have in past years. But we did get it out of the House and over to the Senate. We had a lot of support in the Senate. However, as it's already been mentioned by Howard, we have one senator who threatened to filibuster and got up on the floor and said that's what he was going to do, so they had to lay it over because of the time remaining before the session ended. So we left the session again this year without a PDMP. But the fact that the city and the county has made this bold move brings a fresh air, breath of fresh air back into this issue, because where starting next year, my concern was going to be that they're going to say, look, we've done this over and over again. It's never going to get out. The senator has 2 more years before he's gone. But now the plan is we're going to work vigorously across this state and show that the leadership that St. Louis City and St. Louis County has done can be done all over the state with every county. So that when I go back in January, we can say we have half of the citizens in this state already under a PDMP. We want to have so many counties that they have to take notice. And that's exactly what we're going to do. So it tremendously helps our efforts on the state level. The things that have been said before I spoke are absolutely true. Drug addiction does not know your socioeconomic status. It does not know what neighborhood you live in. It does not know where you come from. My daughter became addicted after just hurting herself at work and getting a prescription. 13 years ago, heroin wasn't the big thing to turn to, meth was. So once she couldn't get the pills anymore, she was taking too many, she couldn't afford them, she moved on to meth. So we've had 13 years of ups and downs in rehab, prison, my grandson born with opiates in his system. That's the reality. That's the face of addiction. It's my face. It's my family. In order to stop this, we have to have more oversight, and that is all the PDMP does. Many of the things that you hear coming out of the Missouri legislature is, well, 30,000 people are going to be able to see your medical records. That is simply not true. The 30,000 people, we're talking about your pharmacist and your physician, the people who already have the ability and your permission to look at your medical records. So there's just been a lot of tainted information that's not quite right, used as scare tactics against this very valuable and important plan. But the bottom line is that the city and the county has now shown the Missouri legislature that we will have PDMPs in the state of Missouri. So I'd like to introduce to you someone who I wouldn't have been able to get as far as I have without his help. Mr. Chad Sabora, who is a fighter within this city and county, and he comes to Jefferson City to talk to legislators to show them what is actually happening in the trenches. He sees this face to face every day and has lived it and has experienced it. So I would like to introduce to you Mr. Chad Sabora.
It's a real honor to be here today. I want to thank Howard, everyone in today, Mayor Slay, all the leadership. There's not too much I can add. I think everything that needs to be said has been said by everyone behind me. However, I will, highlight a few things. Is that, one death every 11 minutes in this country. That's what we're looking at here. And a lot of those deaths, even though we always hear heroin, a lot of those deaths are attributed to prescription pain pills. So this is not only going, when we start to diminish the availability of prescription pain pills on the black market, it's also going to reduce people transferring over to heroin, but it's also going to cut down on the death we are already seeing right now. So this is very, very important because it's very easy to get pills in Missouri. We are the pill mill state. I work all over the country with addicts, treatment centers, outreach workers, and that's our reputation. And it's amazing that the leadership has really stepped up to do this. Never would I think that a city and a county would stand up to a state capital like we have. And being one that tries to thrive on controversy and rebellion, I'm overshadowed by this. It's amazing. You know, and as an outreach worker, I probably, for most of my job, encounter and work with thousands of addicts a year, sometimes up to 30 a day, via telephone or community outreach or some of the things I do. And a lot of them tell me the same story. You know, some were legitimate prescriptions, but a lot of it was the black market availability. You know, and we have to be prepared always as I preach for unintended negative consequences. And this is a big piece of the puzzle, but there's many more pieces that we have to put together, which we've already started with everyone's leadership again, such as more access to immunity laws, more access to Narcan. And then we also need to continue the fight. Prevention is key, but we have thousands, hundreds of thousands of Missourians struggling right now with no access to treatment. It's sad. This is the only disease condition in the DSM that is a criminal issue. It's one of the only conditions of the DSM that does not have point-of-care treatment. And it's heartbreaking to see these kids die while waiting for a bed in treatment. You know, this is going, in the long run, going to prevent more kids from starting the path to heroin addiction. And it's just an amazing honor to be here. So with that, I turn it back over to Francis Lay, Mayor.
Thank you so much, Chad. I want to recognize Alderwoman Kara Spencer, who's with us. She was a co-sponsor of the legislation and fought very hard to get it passed. Kara, thank you for your leadership. And now I'd like to ask all the speakers and Alderwoman Kara Spencer, Chad, and Holly, and Melba, and Lyda, and Steve, and Howard, and also to come up and join me as I sign this. And I'd also like to see if Officer Laura Wozniak is here. Oh, there she is. She's sitting right in front. I'd like to have you join me as well. Officer Wozniak does a great job on this issue in the city. Really appreciate your work.